Go.
Hi, my name is Kamilah. I'm a student nurse, and today I'm going to be doing a chest tube dressing change. So I have already checked my doctor's order, and Miss Linda Clark is due for a chest tube dressing change today. So I have already gathered my supplies, and I'm ready to enter my patient's bedside. So before I enter the room, I'm going to be doing my hand hygiene. I'm also doing my safety check. So my patient is not in distress, the collar is in reach, and the bed is in the lowest height. And now I'm going to introduce myself to my patient. Hi, Miss Linda. My name is Kamilah. I'm a student nurse, and today I'm going to be changing your chest tube dressing. So I'm just going to check your armband here. Okay. Could you please state your first and last name, your birthday, and do you have any allergies? No? Perfect. So before I set down my supplies, I'm just going to clean my table. And this is just garbage. And in real life, I will be adjusting my table and my bed to my waist height. I'm also going to make sure that my patient is in a semi-Fowler's position. So now I'm going to explain the procedure to my patient. Miss Linda, you do have a chest tube, and today I'm going to be changing the dressing for it. So I'm going to be removing the old dressing. I'm going to clean the wound. I'm going to, clean the site, assess the site, and I'm also going to put in new dressing, which I have here. Do you have any questions for me? No? And are you still okay to receive this procedure? Yes? Okay, perfect. So before I open my sterile fluid, I just want to make sure that my chest tube has no kinks and that it is draining well, which it is. That's good. Okay, now I'm going to open my sterile tray. Do my hand hygiene first. I'm just going to open the flap now. I'm going to grab the drape. Okay, now I'm going to grab my garbage. Okay, and I have my IV drain sponges here, my 4x4. It has already been opened since I'm reusing my supplies, but in real life it would be closed. Okay, so I'm just going to make sure that it doesn't flip back. This is just garbage. I have my drain sponge here. Again, making sure that it doesn't flip back. Garbage as well. I also have my jelonet. Okay, this is just garbage. And now I'm going to add my normal saline. Okay, and now I'm going to be putting on gloves and removing my old dressing. Okay, listen now I'm going to be removing the old dressing. So I'm just gonna remove this. Okay, making sure that in real life we don't use scissors when we remove this. I'm also going to stabilize while I'm removing this. Okay, now I'm going to remove my dressing. Okay, and as I'm removing my dressing, I will be assessing my old dressing, and I can see that there is no drainage, which is good. So now I can just discard this in the garbage. I'm going to grab my forceps and remove my jelonet. Okay, and I can just throw that in the garbage as well. And now I'm going to assess the site. I can see that there is no redness, the periwound skin looks healthy, and that there is no drainage, which is good. And also there is no foul odor and any purulent drainage, which means there is no infection. So I'm just going to remove my gloves now. Garbage. And I'm going to clean my hands again. Well, I'm gonna put on sterile gloves, and since I don't have any space here, I'm gonna use this my patient's bed to put on my sterile gloves. Okay. And now that I'm sterile, I can touch everything in my sterile field. So I'm just gonna grab my forceps here. And I'm going to make a rosette now. Okay, I'm going to be cleaning in a 360 angle, making sure that it is one swipe per wipe. This is just garbage. Again, making a rosette. I'm just gonna go back in that area, making sure that I clean it well. Garbage. Now I'm going to clean the outer part. Garbage. Again, I'm gonna go back in that area. Okay, now I'm going to clean my tube. Okay, and now I'm going to clean under. Garbage. Okay, and now I'm ready to dry my site. I'm just gonna grab my 4x4. Making a rosette. And as you can see, it's a little damp from before, but it wasn't because of me putting it in the normal saline. So I'm just gonna dry it now. Again, in a 360 area. Again, it's a little damp from previous filming, but in real life it wouldn't be wet. So I'm just gonna clean another part, the outer part now. Garbage. And my tube would have already been dried by now, so I'm just going to grab my jelonet now. Okay, I'm going to put it there. Now I'm going to grab my drain sponges, making sure that it's in 2 different directions. Okay, and now I'm also going to put my 4x4 in. There you go. I'm also going to put on Mi Fix now, which I've already cut beforehand. And I have also put on my initials, the date and the time. And one more. And when I do this part, I'm just going to make sure that I tent under here to make sure that my chest tube stays intact and that it doesn't get pulled. Okay, now that's done, I'm ready to clean my bedside. And I'm just going to remove my gloves now. Again, do hand hygiene. So I'm going to make sure that I clean everything, and I'm also going to make sure that my patient's bed is in the lowest height. And I'm just going to ask my patient, Miss Linda, is there anything else I can do for you? No? Okay. And before I leave the room, again, I'm going to do my safety check. So my patient is not as stressed, the callable is in reach, and the bed is in the lowest height. And as I leave the room, I'm also going to document that I did a chest tube dressing change, that I removed the old dressing, which is a jelonet, two drain sponges, 4x4, and a Mefix, and that there is no drainage. I'm also going to write down that I assessed the site. The site has no redness. The periwound skin looks healthy. There is no drainage, which means there is no infection. I'm also going to write down that I cleaned the wound with normal saline, and that I put in new dressing, which is jelonet, two drain sponges, one 4x4, and Mefix, and that the patient tolerated it well.